Welcome everyone. I'm going to be pretty short and hopefully sweet. We'll see. I recently, as Gaurav mentioned, have created a training program for healthcare providers. This is an online course that was adapted from a day-long training that I've given at hospitals and medical centers in the past. And the reason I created this was really I felt that we needed to fill a niche in the world. Healthcare providers don't know enough about psychedelics. They don't know about Ibogaine and other entheogenic substances, which, if you're tuned into this conference, you know the importance of these medicines. So there's this pretty haunting statistic where it takes 17 years before information that is identified in research to actually make its way into the daily practices of a healthcare provider. There's a lag of 17 years before we have good data and before those patients in the world actually benefit from it, because healthcare providers can't stay up to date on everything. I don't think we have 17 years when it comes to mental health. I'm in the United States, so I know the statistics here in the United States. As of 2007, so 14 years ago, an estimated 21.4% of US adults had a mood disorder at some point in their lives. So depression, anxiety, another kind of mood disorder. I anticipate that that number has gone up significantly since 2007 and since this pandemic. Here in the United States, 1 in 8 Americans is an alcoholic. And in the world, 50% of individuals will experience a trauma, 8% will develop post-traumatic stress disorder. That risk is double in women. And the risk in Iraq war veterans is 20%. So 20% of our Iraq war veterans develop post-traumatic stress disorder. And that may be why 3 out of every 10 deaths among members of our military are from suicide. So if you are in the United States and you join the military, you are more likely to die from suicide than you are from combat or any other cause of death. So long story short, the treatments we have are not working well. We now know that with antidepressants, we used to think it takes 4 to 6 weeks before we could assess if an antidepressant drug was working. We now know it's more like 2 to 3 weeks, which is good. We can tell faster. But we also know that for example, is another opiate. So people with opiate addiction get put on another opiate, and we know that the outcomes for buprenorphine are better the longer you take it. So essentially, we swap out one drug for another, albeit a better one that lets people get their lives back. And we don't have a lot of new psychiatric drugs going to market. So we are in an era now where we are actually seeing a swelling in mental health issues in the world. More people have mental health diagnoses than ever before. And that percentage of our population is growing. The drugs we have aren't working as well as they used to, or as well as we once thought they did. And we don't have a lot of new drugs going to the market. Another issue that we have going on is that the medical approach that we have is very top-down, in which the patient takes a passive role. This attitude medicine of, oh, hello, patient, there's something wrong with you, and it can't be fixed, but let's compensate for it. And there's a big focus on receptors and chemicals. Oh, you're depressed because you have low serotonin. Oh, you're addicted because your dopamine pathways are awry, and now you're tolerant on this drug. And the role of spirituality is often sidestepped. So as we saw in the panel discussion we just had, Dr. Pashkulin kept bringing it back to, the person has to be willing to heal. The person has to be willing to connect with their spirit, claim their lives, reclaim their free will. And there isn't much of a venue for that in conventional medicine. Even with the acceptance of ketamine into the conventional medical model, ketamine's becoming more and more popular. It's legal in the United States and clinics are propping up. Even the way in which most providers are doing ketamine is very top down, with the patient playing a passive role. It's, you come in my office, you sit down, I put this IV in your arm, and then you go home. Here's your ketamine, bye. And in my opinion, that's the worst way to do ketamine with patients. It has the worst outcomes in my experience with patients as well. There's no room for spirit, there's no room for the patient engaging, there's no psychotherapy, etc. So what I have created is a course where healthcare providers whether they like psychedelics or not, whether they think psychedelics are a good idea or not, healthcare providers can learn about psychedelic medicine so that they can, at the very least, have intelligent and nuanced conversations with their patients. Because whether healthcare providers like it or not, patients are learning about these things and they have questions. So if you're a healthcare provider, would you rather that your patients learn about treatments from listening to the Joe Rogan podcast? Or would you rather that they learn about effective treatments by talking to you? Because you will know their health history and you will be able to tell them if they are or are not candidates, and if so, for which medicine. So in my course, which is called The Science of Psychedelics, it is produced by Microdose. Thank you so much. I really, really appreciate that I was able to pair up with everyone at Microdose to help me launch this course. We talk about the actual risks of psychedelics, the contraindications versus the myths. Does MDMA actually turn your brainstem into Swiss cheese? Do you need to stop taking antidepressants before you take psilocybin? Things like that. Do you actually need an EKG before you do Ibogaine? Yes, you do. So this course is for healthcare providers, hospital administrators, and others who want to learn. And it has been approved for continuing education and continuing medical education. So apparently the APA and ACCME also think you need to know this information. And the course includes modules on the pharmacological mechanisms of action of the classic psychedelics, indications, contraindications, cautions, safety, and what ayahuasca, Ibogaine, and MDMA, also known as ecstasy. There is an entire module on the psychedelic treatment of addiction, an entire module on microdosing, and a module on counseling skills and harm reduction for setting up your own healing space. There's even an optional experiential. No, I don't send you drugs, but I guide you through a meditation to help you get into the space. So you might not need this training, but your colleagues do. And if you're not a healthcare provider and you're tuning in right now, chances are your doctors and your therapists and your healthcare providers might need this training. So I really appreciate you tuning in and hearing me out on this. I hope you'll help me spread the word. And if you visit scienceofpsychedelics.com, you'll be able to get on our mailing list. The course is going to launch at the beginning of March. And I look forward to seeing you there. And thank you so much to Microdose for letting me have the floor and for letting me plug my little microphone into your big amp and helping me create this course and make it possible. I'm so grateful.